The impact of acute gastroenteritis is normally minimal, with an acute onset of symptoms 4 to 48 hours post-contact. These normally last a few hours to a few days. Normally, the effect on living is insignificant, missing minimum work and ADLs. The objectives of this are to note the treatment options for acute gastroenteritis with 90% accuracy, and to understand the impacts of an individual and their family during an episode of acute gastroenteritis with 90%. Treatment is normally easily accessible to people. Most doctors' offices are equipped to diagnose and to treat AGE. Normally, it is with a few blood tests, and they can give prescriptions for some PO medications to help prevent nausea, vomiting, dehydration, because you will not be throwing up or having any diarrhea. If you have a more severe case, then you might be sent to the emergency room for IV fluids and IV medications. And in more severe cases, if that is not enough, the ER might admit you to the hospital, or your doctor might direct admit you to the hospital for treatment overnight or for 2 days or as needed. Normally, in the healthy adult, you can be treated by drinking plenty of clear liquids and fluids and Gatorade to prevent dehydration. The expense for treating AGE does vary. It can be as minimal as buying water and Gatorade, or it can be as expensive as being in the emergency room and admitted to the hospital for a few days. Insurance does cover this, but it can get pricey if you do not have insurance and have to go through this. The effects on living is normally insignificant. AGE is an acute illness and lasts a few hours to a few days. You might miss a day or two of work. The vulnerable populations are the infants and the elderly, and this can be fatal, and that would definitely have a serious effect on that family. There are support groups out there. Drugs.com offers a blog support group for AGE. They will actually update information to that blog, and you will be able to see that and to interact with other people that are on that blog. I did see one article where they were giving information on how to prevent AGE in packing your child's lunchbox. It was showing how to not cross-contaminate meats and fresh produce and etc. Plan of care for AGE would be imbalanced nutrition, less than body requirements. Nursing interventions would be to monitor daily weights and to consult a dietitian. They need to be able to get the appropriate amount of calories, electrolytes, and nutrients so their body can heal, and also to monitor lab values. Medical management would be to replace the fluids and electrolytes lost as indicated by the degree of the dehydration of that patient, and to administer anti-diarrheal medicines as indicated. Also, risk for electrolyte imbalance is a plan of care for this patient. So nursing interventions would be to monitor lab values for electrolytes and the physical signs and symptoms of electrolyte imbalances, such as potassium in the cardiac monitor, assess for signs and symptoms of fluid volume deficit, and to monitor urine output, the color, and the specific gravity. If the specific gravity is elevated, then we might need to give some more fluids and treat the dehydration. Also, the medical management for risk for electrolyte imbalance would be to give electrolytes as indicated by the lab work or the patient's signs and symptoms. Make sure the pH level and the CO2 are within normal range in the lab work. We need to prevent any acidosis or alkalosis in this patient. And also consider Zofran, Phenergan, and Lomotil. These are common medications that are given for AGE in adults. Here are my references. I did find a very interesting fact. According to the CDC, from 1999 to 2007, Deaths from AGE went from 7,000 to 17,000 per year. Adults over the age of 65 were 83% of the deaths. Those over the age of 65 are more vulnerable, and they do need us as healthcare professionals to make sure that they are safe, make sure they do not get sicker, and that would be in acute gastroenteritis. The problem is dehydration. Dehydration is what's killing the patient. So we need to make sure that these patients do not become fatally dehydrated.